Hi, my name is Christian. I'll be performing the Tracheostomy Care video instructions. So first things first is we want to introduce ourselves to the patient. Hi, my name is Christian. I'll be performing your tracheostomy care. Then we're going to do hand hygiene, removing any kind of watch or like bracelet, things of that nature. We want to have just clean hands and skin and stuff like that. So hand hygiene is performed. Next thing we want to do is make sure that our patient is in a semi-Fowler's to high Fowler's position. Also, we want to make sure that their trach is clear of any secretions or mucus. So if there is any of that stuff, then we want to suction until we have a clear airway. Then we're going to set up our sterile field, which we'll be using this tracheostomy care kit. This has the gauze, the trach tie, the sterile gloves, and then the sterile field that we'll be using, and then cotton tip applicators and a brush. So I'm going to remove the sterile gloves out of here. Then with the sterile field, we want to grab it at the outer 1 inch because that spot is not sterile. So we're going to lay flat just like this. Then we are going to dump our contents onto the sterile field. Okay, and then also using this this kit, we want to put hydrogen peroxide on the top part and then normal saline on the bottom part, because we're going to be putting our cotton tip applicators on the saline part and then our inner cannula in the hydrogen peroxide area to clean it, and then putting in the saline to like rinse it off and stuff. So I'm gonna leave that right here. Alrighty. So now that we have our sterile field set up, we're ready to put on our clean gloves, so hand hygiene. And we're gonna be putting on regular clean gloves. And at this point, we wanna make sure that if the patient is equipped to any type of oxygen, to remove the oxygen devices. Okay. And then we're going to be removing our inner cannula. And then also we're going to be removing the gauze from the cannula. Okay, so when removing the cannula, we want to make sure that we maintain the same curvature as it's being put in. So we unlock it and then follow the same curvature, just like that. Okay, then we're gonna put in the hydrogen peroxide so it can be clean, and start removing the gauze, just like that. For demonstration purposes, I'm gonna reuse this gauze. It's the only one that I have, so I'm gonna set it aside right here. But when I put on a new one, or when I put on this one again, it's be considered clean and stuff. Okay, so now that we have all that set up, we're gonna remove our gloves, and we'll be ready to put on our sterile gloves, because now we're gonna be touching the sterile field. So I'm gonna get our gloves over here. Okay, open it up just like this. Okay, make sure your hands are dry because it's hard if they're kind of moist. Okay, alright, now we're gonna put them on. My glove just ripped, but I don't have any more sterile gloves. So obviously, since it's ripped, it obviously I cannot use it. But since I don't have any more, I'm just gonna continue with the video. But normally, if it rips, then obviously I would want to hand hygiene again, get a new set of gloves, and then put on a new set of clean, sterile gloves. But yeah, for it just ripped right now. Okay, now that I have my sterile gloves on, I'm going to get I'm going to pinch the inner field of the sterile gloves, and then I'm just going to discard it. Okay, now I am ready to start using the actual sterile field contents. So first things first is I'm going to clean the inner cannula with the brush. Clean all the edges inside of it and stuff. And then I'm going to dump it into the saline so it can rinse off. Okay, then I am going to use the cotton tip applicators. Put it in the saline and then clean on the outer edges of the tracheostomy. Making sure everything is clean. Okay, use a couple of those. Just like that. Okay, now that we've used our cotton tip applicators and then we also cleaned our inner cannula, we want to make sure that we pat dry the tracheostomy so it's not like moist and stuff. So we're going to use our gauze. Clean this just like that. Okay, I'm just going to put this over here. Alrighty, now that that's all cleaned up and stuff, we're ready to reinsert our inner cannula. It's cleaned, it's been rinsed in the normal saline. We're going to reinsert it using the same curvature or following the same curvature. And then make sure it's locked. And then also now using a new split gauze. This is the old one, but for demonstration purposes, I'm just going to reuse it. But technically, you get a new one. And then you're going to put it in just like this. You want to hold the actual trach because there is a little bit of movement, and so you don't want to cause discomfort to the patient. If you hold it, you kind of give it a bit of a stability. Okay, now that that is on, now we're going to be removing the actual trach tie. You can use the 2-knot or 1-knot method. I'm going to use the 1-knot method. And then I have my new trach tie right here. So I'm going to move this stuff out the way. Now, when removing the actual trach tie, you also want to provide stabilization to the trach because since you're essentially removing what's holding it, you want to be very careful. Okay. Okay, just like that. Pull it all out. You want to make sure that when you tie the trach tie, that you have a little bit of slack, so it's not putting an excessive amount of pressure on their neck and causing them discomfort. So you want to have at least a couple of fingers, 2 fingers of slack, and then tie it, and that would be it. Now we're going to discard all of our equipment, remove our sterile gloves, our sterile field, clean up our mess. We're going to ask the patient if they're feeling any kind of discomfort, and then if they are, obviously we're going to proceed with whatever they're saying. But Mr. Smith is doing okay, so I'm just going to clean up and then I'll be exiting the room. Okay, throw all this stuff away, remove gloves, hand hygiene, and then goodbye, Mr. Smith.